Terbinafine 250 milligrams stands as a formidable ally in the battle against stubborn fungal infections that afflict the skin, hair, and nails. Particularly effective for conditions like onychomycosis, tinea capitis, and various types of ringworm, this antifungal medication operates by blocking the production of ergosterol, a crucial component of fungal cell membranes. Without ergosterol, the integrity of the fungus crumbles, leading to its demise. Typically, patients are prescribed one 250 milligrams tablet daily, with treatment durations tailored to the infection type, 6 weeks for fingernail infections and a minimum of 12 weeks for toenails. While many tolerate the medication well, some may experience side effects such as headaches, gastrointestinal upset, and taste disturbances.